These children are being vaccinated against cholera, a severe bacterial disease which spreads through food and water contamination. They are among the first to benefit from a global vaccine stockpile supported by Gavi. Cholera causes severe diarrhea. If left untreated, it can kill within hours. Those most at risk are usually vulnerable people living in the poorest communities, such as these refugees in a camp near Mokolo in Cameroon, on the border of Nigeria. As Philemon Ayuba, public health officer in Mokolo, explains, there are at least 45,000 people in this camp, he says. These people are vulnerable. Since the rainy season, there have already been cases of cholera in the region bordering the camp. Globally, as many as 4 million people become infected every year. Some years, more than 100,000 people die of the disease. Cholera can be controlled and prevented through better water, sanitation and hygiene, and through interventions like vaccination. But until recently, access to cholera vaccines was very limited. High prices, lack of funding, and a lack of knowledge of the vaccine and its effectiveness meant demand was low, even though the disease is a priority in many countries. Because of this, there's been little incentive for manufacturers to increase supplies or develop new products, and for new manufacturers to enter the market. Gavi sought to address this issue by funding a global stockpile of cholera vaccines. Manufactured and stored in India, the first 110,000 Gavi-supported doses were shipped in August 2015. This came in response to confirmed cases in northern Cameroon. Because of the ease with which cholera can spread, speed is essential, both for countries and alliance partners, to confirm cases and get the vaccines where they are needed most. In Cameroon, the new vaccine has proved highly effective, says Philemon Ayuba. It's a single-dose vial that's easy to administer, he says. Because of this, it has gained a lot of support. In just 3 days, we've vaccinated half the camp, with the rest soon to follow. The stockpile has also had a positive impact on the vaccine market. There are now several other cholera vaccines in development, which should help bring down prices and increase supply and ultimately prevent future cases of cholera by protecting those most in need.